Hello, everyone, again. Happy Friday, and thanks for joining us again for our all-colleague COVID-19 update. We'll get started right away here because I know time is tight. There's always so much more to cover than we really have time for, but I really appreciate you taking the time to see this live and then to go out and take a look at it as it's taped and held back for further viewing. So first, I want to thank everybody for everything that they're doing, but I also want to remind people to support our local businesses. I know that when we are stuck here at home, it's sometimes seems easier for us to go out to Amazon or to other sites that can have stuff right to our homes. But it's really important to support our favorite restaurants, craft stores, and others as they close parts of their businesses to help keep our frontline medical staff safe and to social distance within the community to keep everybody safe. So please think locally first, whether it's in Duluth or Brainerd or Fargo or anywhere in between. Our local businesses are an important part of our community, and please think of them first, and let's try to support our local businesses. As we work our way through this, we want our friends and neighbors here with us because they've supported us so well in the past. They've supported us so well through this. We want to support them now so they can support us in the future. We have a busy agenda here today. First, we're going to talk about universal masking reminders. Then we're going to talk about providing a safe environment for our patient. And then we're going to spend a significant amount of time today answering your questions. And I want to thank you all for sending those questions in. They're very helpful to us to frame this, to give you the information that you need to get through your day. So first, some universal masking reminders. Today is the 1st of May, and universal masking starts today. So this is the day that every patient, visitor, and colleague is wearing the appropriate mask continuously while in our facilities. Direct patient care staff use your surgical mask or the N95 as appropriate to your role. Plus, the CDC and the Minnesota Department of Health have asked us to add eye protection because the COVID-19, the SARS-CoV-2 virus can be spread through mucous membrane contact, and that can include our eyes. Non-direct patient care staff were asking to use cloth masks, and our patients and visitors were asking to use cloth masks as well. You may be aware that we have reached out to our communities to ask them to please continue to produce those masks for that and donate those masks to us. But every one of our patients who can bring their own mask, whether it's a cloth mask or another mask, we're asking them to do that as well. As an important reminder to preserve this PPE to allow us to serve as many patients as we possibly can and to keep us all as safe as we possibly can, we want to ask our staff who are wearing the N95 mask to continue to follow the standard work to reprocess those masks 10 times if not soiled or visibly damaged. Our colleagues gave us a great update on how to do that earlier. Surgical masks, please have a supply of 5 masks and rotate them, letting them rest for 5 days before reuse. Cloth masks, we want you to wash and reuse your cloth mask every day. We don't have enough cloth masks to get everyone a new cloth mask each day at this particular point in time. And as I mentioned, we continue to remind patients and visitors to wear their own cloth masks when they come to our facilities. So please help us spread the word. Please be a good healthcare ambassador to our friends and our neighbors to spread the word. And then please, if we see one of our colleagues using a mask or touching the face, let's very kindly remind each other on how best to use our masks as we're doing this. As we start to work forward and work our way through this, we recognize that this isn't going to be one just big wave that comes through and then we're over. At the start of the pandemic, if you'll recall, to keep staff and patients safe, we really needed to preserve our PPE supplies. And we put our elective surgeries and other procedures on hold for a while because they use a lot of that personal protective equipment, and it was something that we could do to preserve that personal protective equipment. And if you recall, Minnesota Governor Tim Walz ordered a non-emergent surgeries and procedures to be postponed to preserve that PPE and actually put out an executive order that requires us to do that. But our healthcare needs change over time. And we all know that just because a surgery wasn't emergent, it didn't mean that it wasn't time sensitive, that it needed to be done in a certain particular amount of time. And we're finding that's really creating a burden for our patients who need surgeries or procedures and have had waited this long. And the governor understands that, the Minnesota Department of Health understands that, and other healthcare providers understand that as well. It's also important to have proper management of our chronic conditions because we want our patients to stay well, regardless of whether they're at risk for COVID-19 or whether they think they might get COVID-19 or not. We can't forego our preventive screenings. Those are the things that keep us healthy. And we also notice that many patients are behind on their needed vaccinations. We can't wait until we have a COVID vaccine in order for us to keep up with our needed vaccinations. So what's the consensus right now on what this recovery from COVID-19 is going to look like? Rather than just one big wave coming through, likely there's going to be several waves that come through here, a first wave, a second wave, or perhaps it's just a large plateau, or maybe it's going to be sawtooth. But what we really need to do is to start to return to providing services to help limit the second and third waves of people getting ill from things that weren't addressed originally. We have to prevent that impact on non-COVID conditions as well. So what I'm saying is we got to, for those of us that swim in Lake Superior in the ocean, you want to keep your eye on the waves, but you also have to watch out for the undertow. So while we are waiting for this wave and watching this COVID wave that's likely coming, we also have to watch and address the undertow that can be pulling some of our patients down because of their chronic diseases or their need for services. So how are we going to do that? Well, first, we're better positioned to restart these services. Social distancing has pushed back the surge and it's also flattened it. You and everyone has worked very hard to conserve our PPE, and we're also more adept at tracking the really high use items so we know where we are literally on a day-to-day basis with those. We've been able to expand our testing to identify more of the cases of COVID-19 to help us address those that are truly infected beside those that really aren't. And we've also been able to now implement universal masking to keep our patients and staff safe. And we also, as you know, those of us that come in and out of the organization on a daily basis, we're doing patient, staff, and visitor screening at all locations to help identify people that may be coming down with something that we don't want in our environment. So we are taking it slow, but we are starting to open this up. Our colleagues in Fargo started offering some surgeries and procedures this week, and I want to thank you to all the teams that make this happen. This has gotten to be much more complex and much more complicated than just going back to the way we were before. There's a lot of different steps that have to take place in order for us to keep our patients and our staff safe as we resume these activities. So what we're doing is we're using a phased approach, focusing first on the surgeries with minimal impact on inpatient bed capacity and PPE usage and see how that goes. There may be starts and stops with this as the pandemic progresses. If a wave hits and our hospitals are full of patients and everybody's working hard with that, we may need to throttle this back or stop it. But as that wave comes through and we get back to what we would call more normal operations, we would pick up that activity again. We're also looking very closely and following the state guidance. Right now, we're awaiting guidance in Minnesota, which requires a modification to the governor's order to do that. And literally, we're working with the Department of Health to give input to a draft that they put out. All that input should be in by noon tomorrow on Saturday. And I'm looking forward to us getting some firm guidance from the governor later next week. We're also determining what we can offer in Wisconsin. And we've consulted the North Dakota governor before slowly resuming surgeries, and he and his staff was supportive as well. So we are going to continue to work forward with those procedures. We also know that there are patients that need to come into the clinic. And so our colleagues in OBGYN at the Baxter Clinic in Brainerd are doing a pilot right now to help get those started again, because there are specific health needs for in-person visits and virtual visits, and we can't address everyone's health need through a virtual visit. So what we're planning is they've worked out social distancing in the waiting room. They've also staggered the schedule between patients that they're seeing face-to-face and patients they're seeing virtually to promote fewer people in the clinic at one time to allow that social distancing. They're continuing to watch their PPE supplies and doing PPE conservation and using stringent cleaning protocols in the waiting rooms and exam rooms. And we will implement and audit these new efforts so we can spread these learnings across the organization as we get back to the new normal of seeing patients both virtually and face-to-face and getting back to the procedures that our patients and communities need. What we also need to do is we need to encourage our patients to return. We're all becoming very concerned about people foregoing needed care and ending up more and more ill. So what we're finding is that as we're calling our patients to reschedule their services, some patients are very hesitant about coming in. There is a level of fear out there that we need to help our patients work through. So what we want our patients to know is that we're doing everything we can to keep them safe. We also need to explain to them that there's also COVID in the community, and really you're probably probably more likely to get COVID out in the community someplace as you would in a healthcare setting. But we would like each and every one of you to be an ambassador for health. Help spread the word to your friends and neighbors that we're doing everything to keep them safe within the clinic so they can get the care that they so badly need. So with that, I am going to, there have been some more questions about the surge, and I want to thank our colleagues in the modeling team for this. And what I'm going to do is turn it over now to Steve Waring, our principal scientist. So with the news of some states starting to roll out the opening of certain businesses, how safe or smart do you think that is? And is this going to push the surge sooner than expected? Steve.
Boy, that's a great question, both of those. And as we know, this is a balancing act. And as Dr. Herman alluded to, there are a lot of moving parts to this. And there are a lot of things that we're making progress, and there are a lot of good things that are happening, a lot of preparation. We're trying to get back to the normal business for our patients that are non-COVID related issues, both emergent as well as chronic. And so as we begin to look at the models closer and say, okay, well, is this a good idea? Because the models seem to still be going up. We haven't crested that tsunami yet. And so when we're looking at the models, the biggest factor that has an impact on our models that are letting us be prepared and letting us not be so close to that surge capacity is this thing called doubling time, which just means how long does it take to have twice as many cases. We're out at, because of the effects of social distancing and stay-at-home orders, we're out at 16 days right now for Minnesota. That's impressive. We started at about 2.5 days, or at least that was the assumption based on the information coming out of China and other places. And so with that in mind, we really feel like as we do go back and relax some criteria, as the slide that Dr. Herman showed, we expect there to be another wave. And we don't know how many waves there are going to be. We don't know that shape. Is it going to be sawtooth? Is it going to be kind of a tabletop plateau that we just kind of have a maximum point that over time, it seems like we always have this many in the hospital beds? We don't know that, but our models accommodate that because we're using real data and real-time data based on our own experience. And so that's a lot better than even using a state level model, much less a national level model. So when we begin to look at those, we say, okay, well, if we relax this, we know that doubling time factor is going to change, but we also know that we probably know enough about how effective it was so that if we do relax it, when we look at that second wave, and certainly that's going to happen in North Dakota and other places because as of today, they're trying to go back to business as usual. So as we learn from that, we'll also learn when we go back to that point and we're kind of expecting that second wave, when is it going to come? How big is it going to be? We have things that we fine tune in our model that will be able to accommodate that monitoring of that so that we can say, okay, it's coming back up. We're getting to a threshold level where now we need to kind of go back to that more strict stay at home and all. So there's still a lot to learn on this. And I do feel like our governor in the state of Minnesota is doing a really excellent job of kind of paying attention to the science and also paying attention to the economy, and I'm hoping that balance that we need will come soon.
So Steve, is it safe for me to say almost in a one-word answer or one-sentence answer that it just depends on how well we continue to social distance and do the other things to keep ourselves safe?
Very much so. And I do think, uh, and I appreciate that, David, because being from Texas, my culture is that I can't do it in a short three or four words like that, but very
No,
succinct. I
that's
appreciate
that's
that.
that no, no, that's fine. That's fine. So I got another question for you, Steve.
Okay, sure.
The modeling shows that there will be a surge peak about the middle of July or the middle of August. As we've seen the doubling times go out, it could even be later than that. There's another IHME model that I know we've talked about here before in other meetings that shows a surge peaking around May 1st, then slowly dropping through the months of May. That model, as the person asking the question, seems to be catching this current wave where no wave is showing for the Essentia model. Is that because our model is focused on tracking our region and not the central or southern part of the state? And I'm going to add a little bit on that. It seems to me, as I'm looking what's going on in the state, that hot spots such as meatpacking plants and long-term care facilities are really what's driving the model right now. So I'll turn it over to you, Steve, for the answer.
Yeah, you're exactly right, Dr. Herman. And I think that this comes up all the time. First of all, as we've said all along, there's not just one model that you want to look at. And having so many different models has really been a benefit to us because we're looking at a lot of models to make sure we're not missing something. And certainly we want to be wrong on our model if it looks like it's going to be a tsunami and we're going to be overwhelmed. Uh, but by the same token, we don't want to under prepare, and we don't want to send some information out from our model that makes it look like, hey, this is gone. We can go back to business as usual. And so the one model that unfortunately, and I'm pretty sure I'm even speaking for the folks at the University of Washington, unfortunately, their model has become kind of the gold standard for some reason. And we know that that's not the case, and they know that that's not the case. But the biggest difference in their model compared to our type of model that many places, Oxford and other places are using, is that they're looking at a curve fitting model where they're making some assumptions on the distribution of this in the population, and they're using deaths as their primary input, and then reconstructing if you have this many deaths, that would be that many out of a population of this. And so they're trying to reconstruct that in a way that it is very unstable for the long term. And it's those types of models are much more effective for very short term forecasting, whereas ours is kind of looking at certainly a short term, but a little bit further out. And so I think it's just the differences in these models. But I think the point about that this person makes in terms of, is it because that we're looking at more regional? Yes, and that's the reason that we want to base our models on our own information, because we already know that things are different in northern Minnesota than they are in southern Minnesota. We also know population density. There's a lot of things that would impact our models because it has a lot to do with social distancing and many other things.
Oh, thank you very much,
Sure.
Steve. So we'll continue to watch this. And I want to emphasize something that Steve said is right now what we're doing is we're preparing for the worst and hoping for the best. And the models are the best guideline for us to do that. So thanks, Steve. And thank you to you and your team who have been so good with the models and so good about coming and answering questions when we've needed you to do that.
Sure.
Now we'll try to get to some questions that people have asked. And first is a mask question. And I personally have not been able to find elastic to make cloth masks. Would you accept tie masks? I've made many tie ones for family and friends and would continue making them if able to donate. First of all, thank you very much, and thank you for the masks that you have made. Your family and friends are very fortunate to have your sewing skills. We reached out to Brian Zuck, who, as you recall, is our supply chain leader, and he says, yes, we are gratefully accepting tie masks. He said, for as a reference, 100% of the Frost River masks are tie masks. Our cloth masks tend to be ear loop masks. The tie masks, he says, are a little more cumbersome for end users, thus the preference for ear loop masks. Although there are also some of us whose ears are getting sore from this, and I want to thank the people who have made or purchased or supplied us those things that keep the pressure off the ears that allow you to hook your mask behind your head. But some of us may actually prefer a tie mask as we go forward on this. So I want to thank you for the question, and thank you for the masks that you've made. Here's an interesting question on testing that I think will come up more and more often, and the answer to this question will likely change over time. It says, back in December, I was sick for a few weeks. I had some of the various symptoms that were similar to COVID-19, a cough that took a long time to go away, lost the sense of smell and taste. I finally went to see my primary care provider, and he said I probably had some form of bronchitis, and he prescribed me some antibiotics. Is there any possible way that what I was sick with was COVID-19? I've had a couple of friends and coworkers who said I should get tested to see if I have the antibodies in my system. Should I send this note to my PCP, or was this just a coincidence? Well, here's what I can tell you. The first date that COVID-19 was described in the United States was in Washington State on January 20th of this year. So unless you've traveled probably to a region of the world that had it, like to China or someplace, you're probably very, very unlikely to have that. As you know, there are many viral or bacterial infections that could have contributed to your illness, and many of them have the same symptoms as COVID-19. However, for those of us that had it later, the answer to that question may likely be different. So what we would say is reach out to your primary care provider. As we discussed when we were talking about testing earlier on Tuesday at our forum, the pre-test probability is important in the accuracy of the test. And your primary care provider can walk you through that and come up with a better answer than we can here within this meeting. But thanks very much for that question. That allows us to cover things that are perhaps difficult to cover just in an education session, and it also helps us to reinforce some of the things that we've seen and heard before. We also have Sarah Carlson with us here, and with an HR question that we received. If I could read it here for you, Sarah, first. It seems likely that the employees who are out on special administrative leave won't all return at the same time from leave. There's a lot of talk on patient volumes. For those departments who do not have a direct patient care and no patient volumes to go on and off, how will it be determined when those employees can start returning to work? Will our supervisors and managers receive a return to work plan? And 3, will supervisors and managers have a say in which employees are brought back and when? So Sarah, thanks for joining us, and I'll turn it over to you.
Sure. Happy to be here. So we understand that the concern about not knowing creates for people, and it's a really challenging time to handle the unknown and the uncertainty. We are continuing to monitor our patient volumes and our business needs in terms of what work needs to be done right now and what work can we not do right now in this very challenging time for our organization. So given that, we know that the special administrative leaves are planned to continue through May 31st. And what we can commit to doing is sharing updates to that information as we know it. In terms of the second and third part of that question, we really rely on our leaders to help us plan for the work that needs to be done in the organization. And so as we start looking at things like what are the surge planning models showing and what does the prediction show, our leaders are very involved in building what those plans are going to need to be for work in their areas. And the same is true in our non-patient care areas, where we have to make decisions about which work are we going to do and which work is maybe going to wait. So it's not a perfect answer, but it's what we know right now, and we'll again continue to be committed to sharing what we do know when we know it.
Thank you very much. Is there anything else you'd like to add, Sarah?
I don't think so.
Okay. Well, what I'd like to share on this is all of us are working very, very hard to try to get everyone back to work and try to get back to where we were before COVID-19 hit us. What I can say is that we will probably likely never get back to where we were. And by that, I mean doing things the same way we did before. And so what we're trying to do right now and what we need to do is to invent a new way of developing the care that we are giving. And I want to thank everybody in the organization, from the people that are designing and working with the virtual visits, to our colleagues out in the West that are now getting started with the procedural practice again, and really re-navigating that particular process to keep our patients safe, to keep our staff safe, and to keep track of the PPE and not overwhelm the system, to continue to be prepared when the surge comes. I want to thank our colleagues in Brainerd and here in the East Market and out in the West Market. They're starting doing pilots to bring patients back in to the clinical setting. That is incredibly important that we design this well. We are always concerned about, are we going too fast or are we going too slow? And we're trying to navigate those waters. The difficulty of going too fast is that if we make a mistake and someone gets ill within one of our clinics, we'll have to go all the way back to square one. The difficulty with going too slowly is that our patients don't get the care that they need. We can't bring our employees back to work at the pace that we would like to. So the way I've said it is, we're walking along the top of a very sharp fence. And we have to be very, very careful as we do that. So the moniker that I've adopted this is as fast as possible and as slow as necessary. We'll need to be thoughtful, we'll need to be careful, but our priorities are shared with everyone in the organization. We want to get back to work, taking care of our patients and our communities, and get our employees back to work as quickly as we possibly can. I always end these little get-togethers with a thank you, and I received a note today from Joanne Bresnahan, and I want to thank Joanne for sending me this note, because she expressed, and I wish Joanne could jump on with us, but she expressed gratitude for the CMAs, the LPNs, and the RNs that are doing the work that happens before people have their virtual visit. I don't know, those of us that have had a virtual visit know, but I don't think all of us know that before a patient has their first virtual visit, we reach out to them and help assist them with Zoom, make sure that things are done the way they're supposed to do, make sure they go through the form and fill out things correctly. So when the time comes for them to be on with their physician, everything is going as well as it possibly can, and people are able to do that. So I want to repeat Joanne's thanks, and thank you to Joanne for calling this out. To everybody that's behind the scenes that's making this work. We are reinventing healthcare as we go through this. There is no book that we can go on to Amazon.com or BarnesandNoble.com that says how to restart your practice in the new COVID-19 world. We are working through that, and it takes the innovation, the diligence, and the hard work of everyone in the organization to make sure that that happens. To give you an idea of the scale of the work that we're doing right now, of all the virtual visits that are happening in the state of Minnesota, Essentia Health is doing about 25% of those. And that's really important to care for people that otherwise can't get their care. And I am so proud of the way our team has stepped up to work on this. So proud of all the work that's gone, about the reinvention that's gone through. And I'm just so pleased to see the way that people have embraced the new world. We've all spent a little bit of time mourning the old world when things seemed as if they were going well and things were easy. But at the same time, I'm confident that when we're through this, and even in the middle of it, we'll be serving our patients better than we were previously, because it will be more patient-centered, it will be more convenient to them. We will likely be touching our patients more often, particularly those with chronic diseases, because in the old world, they would have to get in the car or have their son or their daughter pick them up and drive them to see us, when now we can just reach out through their screen on their computer or through their iPad or other laptop device that allows us to really be able to do that and be aware on a real-time basis. I also want people to know that for our strategic plan for fiscal year 2021, we are going to be working with vendors that allow us to provide some of the care that we provide in the hospital right now at home. We can get the monitoring devices and lend those out to our patients, because if you're not sick enough, that's so sick that you need to be in the hospital, we can provide the support literally on a minute-to-minute basis in the home to allow you to do that. So I want to thank everybody for the great work that they've done. I want everybody to continue to think about questions and email your questions into us. That gives us the best idea of how we can better serve you with the information that we provide. I want everybody to have a great weekend, stay healthy, and we look forward to interacting with you again next Tuesday, if not before. So thank you, everybody. Please stay safe.